Hi everyone, welcome to this presentation on understanding trauma implications for the classroom. This is one of the professional development series for the Trauma Informed Research Collaborative. My name is Dr. Gina Rahimi, and I am part of the team that is offering this professional development that includes Dr. Dolores Liston in the Department of Curriculum Studies, Dr. Tamara Hunt, who is in the Department of Kinesiology, and Dr. April Garrity, who is in the Department of Communication Sciences and Disorders. I am in the middle grades and secondary education where I serve as a professor. Prior to my work at the Armstrong campus of Georgia Southern, I was in public schools as a middle school teacher for 15 years. I have recently become very interested in the idea of trauma-informed practice as a framework for understanding behaviors, experiences of students that are served in those classrooms. And so this presentation is going to provide just an overview of the general implications that trauma has for classroom teachers and other staff working with students. So the first thing that we want to talk about is when we talk about trauma, understanding what we mean, and it's become a popular term as of late, but if we drill down to what the definition of trauma is and how that is manifested in the classroom, I think probably one of the most important bodies to get our information from is the Substance Abuse and Mental Health Services Administration. They actually have produced a lot of work and a lot of information around trauma-informed practice. So I would urge you, if you want a deeper dive into the topic, to explore the work that they do. But they start by saying that individual trauma results from an event, a series of events, a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning, mental, physical, social, emotional, or spiritual well-being. And I think this is an important definition to unpack because we look at trauma. It could be a series of events in a child's life. So it could be a series of violent acts, a series of divorces, or movement, for example. It could be something that is astute and is a one-time event, the loss of someone, a physical or emotional abusive situation. So looking at trauma in terms of it could be something that is sustained over time for students, or it could be something that they just experience one time. But it does have an impact on their mental, physical, social, emotional, or spiritual well-being. And I think that's probably the most important perspective to understand, is that this trauma that is in students' lives can impact what they bring to the classroom and how they interact with teachers and with their peers. And that's the basis behind my interest in trauma-informed practice and a lot of the work that's being done around that in classrooms. So to give you a little bit of background, and I have embedded some links within this presentation that I would urge you to spend a little time experiencing. This presentation is intended to give you an overview of the topic, but certainly you are welcome to pause the slides and go through the links to gather more information. But the background behind trauma-informed practice really starts with the CDC Kaiser study that happened in the mid-1990s. And Andy and Folletti conducted the study for this Kaiser CDC, and they surveyed 17,000 adults. And it was really to try to figure out why these adults were experiencing these adverse health symptoms. And what they came to find out was that a lot of these adults that were experiencing these physical ailments also had in common that they had experienced some adverse childhood events. Those became known as ACEs. In the original study, there were 10 adverse childhood events: divorce, violence in the home, having an incarcerated parent, poverty. And you can click on this link here to find your own ACEs score so you can see what the adverse childhood experiences ACEs were at the beginning. And what's interesting about this, and this is the whole basis behind the drive behind linking trauma to and trauma and adverse childhood experiences to educational and health outcomes, was it has been found that the higher number of ACEs score someone has, so the more negative adverse childhood events they've experienced, the more adverse outcomes they have. And before I switch to the next slide to elaborate that a little bit more, I have put a link here for the original ACEs study. I've also put a link here for a TED Talk by Nadine Burke-Harris, and she actually details in rather poignant ways how childhood trauma can affect health across a lifetime. So I would urge you on your own time or during this presentation to pause and link to that video. I think you'll find her work incredibly important. But to just talk a little bit about the idea that these ACEs, these adverse childhood experiences, and what the impact that they can have over the course of someone's lifetime. The original study found that 64% of adults reported at least one ACE. And what's important about that early study, where these were largely middle class folks in California, many of whom had health insurance. And so if you take a population that was less affluent, there is a lot of research that suggests these ACEs scores will be even higher. 1 in 5 reported more than 3 ACEs. And again, confirmed by years of research, the higher the ACE score, the poorer the health outcomes. And we see this with adverse childhood experience, how they disrupt neurodevelopment. There's been a lot of work on how traumatic events actually physically impact the brain and the way that the brain gets developed. And so again, there's a couple of links here for you to find information about ACEs in Georgia, but more specifically exactly how the brain is impacted. And we know that through fight or flight, what it does to the hippocampus, what it does to the prefrontal cortex. There's lots of research on that, and that'll give you a little bit more sophisticated discussion of that. But we know that neurodevelopment, it gets disrupted. There's social, emotional, and cognitive impairments that go along with traumatic events. And this leads to the adoption of health risk behavior. So drug use, lots of promiscuity and risk-taking behaviors, disease, disability, and social problems. And ultimately, these adverse experiences can ultimately lead to early death and physical health issues. So just in brief, again, that study studied and assessed the effects of child abuse and related adverse experiences. You can see that fully 2/3 of the study reported at least one. And ultimately, this study has informed us that these can have an enormous impact on the health and productivity of our society. And here's a couple of other links that I would just bring your attention to. One is about preventing childhood abuse, because we know that has been on the rise as of late, and that certainly serves as one of the most traumatic childhood events that can have lasting outcomes for students. And then again, a little bit more information on the ACEs tool. Again, the early ACEs had 10 rather specific examples of childhood trauma. That has been expanded as we've come to understand that other events can lead to trauma. So certainly mild maltreatment, physical abuse, emotional abuse, sexual assault, sexual trafficking, emotional neglect, and physical neglect are certainly biggest examples of trauma. But we also know that there's students that experience household trauma and household challenges, like seeing a mother or guardian being treated violently, looking and living with substance abuse in the household, living with mental illness in the household, dealing with parental separation, and that can come in a variety of ways, not just incarceration, but that is one example. And then we know now that an expanded sampling of adverse trauma looks at things like poverty and living in poverty, what that does to the brain, and how that can create trauma for students, peer victimization, peer isolation, which I highlighted here because we know that many students through the COVID experience and being isolated were actually experiencing this level of trauma by being isolated by their peers, exposure to violence within the home and within the community, foster care experiences, family illness, and grief. So these can all be experiences that research have found can lead to this childhood trauma and can lead to these negative impacts that could particularly cause disruption in behaviors or cognitive functioning in students. So what is this implication for teachers' practice? As we consider the diversity of the students we serve, we need to keep in mind that students have diversity of experiences. And so not all experiences that students have are pleasant. So we need to consider that there will be students in our classrooms that have experienced some level of this trauma. And I just want to point out a couple of things that the American Psychological Association has said, that trauma can produce this emotional response to a terrible event. And so in the next sections, we'll talk a little bit about how childhood trauma can impact physically, emotionally, psychologically, and cognitively development in students. I just want to remind teachers, and I think we early on in our teacher preparation program, we get introduced to Abraham Maslow's hierarchy of needs, and understanding that one cannot learn if one is dealing with the absence of basic needs. So I just hearken a reminder to everybody to look at this YouTube video, which underscores Maslow's hierarchy of needs as a reminder that as we're designing our classrooms and thinking about these lived experiences of our students, that we put their biological, sociological, psychological needs in our thoughts as we're developing their lessons. As a result of complex trauma, it has been found that there's lapses in cognitive function. Students can often be seen to be in a constant state of fight, flight, or freeze, and this is where students may be out behaving, having outbursts, etc., because they're living in this state of fight, flight, or freeze. Difficulty managing emotions, psychosomatic symptoms. They complain of illness. They are require frequent trips to the nurse or ask for frequent trips to the nurse. Hypervigilance, they're always on alert. They overreact to small issues. They can't regulate their behaviors. So all of these are oftentimes behaviors that obviously disrupt the classroom, but really relate to some underscoring issue that may signal that that student has experienced some trauma. And so how classroom environments can cause and trigger some of those traumatic events can be unexpected events, when there's fire drills or changes of schedule, when students are not prepared for that, class assignments that may trigger some unpleasant memories, or sensory triggers. How can we think about creating an environment where those triggers are managed and mitigated? And in another presentation, I'll be speaking specifically about these practices and how they can be supported by teachers to help mitigate some of these reactions. Recognition of signs. It's important as educators that we recognize the signs. Obviously, we go through mandatory reporter training, but I have linked a couple of documents here just to remind us what signs look like. And what we need to do when we see those signs. And as you view these, just think about these common questions like, what are the signs of physical abuse? How will I know if I see them? How is neglect defined? What are commercial sex trafficking indicators of youth, which is now we know that there's sex trafficking. Um, would we recognize it in our own classrooms? And those links can help you with some of this information. What are signs that youth may be suicidal? What's an indirect versus hint versus a disclosure? What are the rights of you as a mandated reporter? And to whom should you report abuse or neglect? You may have had this training recently, but I would urge you to revisit this if it's been some time, and just to update you on some of those signs that students may be experiencing some of those traumatic events. And lastly, in this presentation, here's some recommended resources. These are resources that will give you a very general perspective on childhood trauma, the ACEs study, PTSD, kids' mental health information. These have all been vetted. I think you'll find them rewarding and will provide further insight into this topic. Lastly, this is a reflection survey that we are asking that you just provide some feedback about this particular presentation and its helpfulness. Hopefully you'll have a chance to go through the links and see if they've been helpful to you. In subsequent presentations, I'll be speaking about specific classroom practices that teachers can engage in to mitigate the effects of trauma-informed practice. I will also be providing some information about what trauma-informed schools look like in particular. And lastly, just very specific practices about how we can, how instructional pedagogy and classroom management practices can be very simply set up to create a trauma-informed practice. I appreciate your time and I appreciate you thinking about these topics. And if I can help in any way with resources or anything else that you need, I'm happy to do it. And I appreciate, again, all the work that you're doing, and I wish you the best.